Everyone, and welcome to our weekly session with nurse practitioner Ann Walsh. Our series is called Wound Care Pro, and it's brought to you by Wound Care Pro. It's a downloadable app. It's for physicians and clinicians to help guide them in caring for wounds, whatever wound you might face, whether it's pressure wounds or diabetic wounds, whatever your patients come in with. So it's only $4.99 in the App Store, so you can check that out. Meantime, today we are going to be addressing diabetic foot kick. Diabetes is a really big problem. Every 20 seconds, somewhere, someplace, sometime in the world, someone is getting an amputation due to a diabetic wound. That is not good. And so it's important that diabetics in particular are taking care of their feet. I saw a stat that like half of American adults are at least pre-diabetic. So this is something that should affect so many of you. So in order to find out what it means to take care of your feet, we have nurse practitioner Ann Walsh here. Make sure if you do have questions, you can go ahead and post them in comments right there on YouTube. And we have our amazing producer, Joshua, who will grab those comments and bring them to our attention. Any questions you have, we'll also be able to get them to Ann during this session as well. Welcome, Ann. I know we took a break last week, but we're back and we have a great topic with lots of information ahead.
Absolutely. Great to be here.
So where should we start? I mean, why is it important for all of us to take care of our feet, right? It's really important. But why is it different for diabetics?
Yeah, I mean, it sounds simple, but simple diabetic foot care could prevent a lot of these complications. And as simple as assessing your feet every day sounds, but if you don't have the feeling in your feet, maybe that the non-diabetic would have, you may not know you have a problem and be able to catch it early. So daily assessment of the feet, if you can't see the bottom of your foot, you may have to use a mirror or have a caregiver help you. And, just if you see anything, a wound, God forbid, or redness or a callus that needs to be addressed, you can catch it early. So daily assessment is first, daily cleansing of the feet, including in between the toes with a mild soap and water, nothing harsh with chemicals or any of that, and drying well the foot and in between the toes so we don't get moisture and a fungal overgrowth there. So it's just it's so important for the diabetic to offset these horrible complications that may come about.
I mean, when you're talking about making sure that your foot, and especially in between the toes, is dry, is it just a regular towel, or would you suggest some sort of a highly absorbable cloth or something like that to really get in there and make sure it's extra specially dry?
Yeah, I mean, a regular cloth that's soft, nothing harsh that's going to be abrasive and cause more problems, especially if the person doesn't have that good feeling and may not realize they're rubbing so hard and taking off the skin with it. Especially in the summer months, we're walking around, you might be sweating a little more. So really to keep on top of that is important. And if your sugar's on the high side, fungus loves, sweets, so they'll extra risk of a fungal infection in between the toes and the toenails,
Oh,
for that matter.
can you just repeat that again? Because especially with diabetics, so I think that there's you need to create a strong correlation for them between the sugar that you're ingesting in your body and your feet and the fungus. So when you're saying your blood sugar is high, well, that sugar makes your blood syrupy, right? And it gets and clogs up the capillaries and gets up towards the surface of your skin. Like it feeds, like your bloodstream is feeding, right? Bringing the nutrients and oxygen to the skin. And I imagine if it's syrupy, you're not getting those nutrients and oxygen to the surface. And your blood is sweet. And
Absolutely.
so you're ending up with just attracting a bacteria and things like that, right?
Absolutely. And fungus, in the summer months, we get people with the, rashes under their arms, any kind of like, skin folds. So the toes, in between the toes are no exception, that the moisture can be trapped. And the diabetic person, especially if the sugar's out of control, they're more at risk than somebody that either has no diabetes or has diabetes, the blood sugar under control.
So you mentioned really being careful and no harsh soap. Do you have any um any advice for when you're shopping for soap, the ingredients that should or shouldn't be in there? I would imagine making sure that there's no perfumes in it is probably on top of your list.
Yeah, I would say like any kind of fragrances or harsh chemicals, not to use brands, but Dove is a nice, gentle one, or some of the other ones that don't have any of these additives to them, that they're all natural. And want to rinse the feet well as well to get all that, but not leave any kind of soap film on the foot. Because you don't want
For
to over dry
diabetic,
the feet where the fact that they can get cracked skin, and then that's an opening for bacteria or other infection.
for diabetics, we always hear a lot, do not soak your feet. Is that is that truly the case, or is there a way that you can soak them, make sure they're dry, and or is there a certain amount of time, or just not at all? Do not
Well,
soak your feet.
yeah, we always say don't soak your feet, because if there is anything kind of brewing, locally, it's a risk of spreading. And then you don't want that skin getting macerated, and it's like dishpan hands. If your hands are in the sink, gets that soft, and that could peel off and cause more problems. And you want to be careful the water's not too hot. If you submerge your feet in hot water that your feet, you don't feel with your feet. So sometimes you have to use your elbow or something to check the water that's not too hot. You can certainly wash your feet, in water, but I wouldn't let them soak. That's always been our, educating folks, and I think there's no change with that. And then after you dry your feet and all that, you can moisturize your feet so they don't get overly dry, but keep in between the toes dry.
Yeah, I've heard that before. So when you're moisturizing your feet, you don't put that cream in between the toes at all.
Right. Just all around, any dry skin and calluses, it'll help soften that, but not between the toes. Because then again, you're adding that moisture where it doesn't belong.
What are your favorite ingredients
I mean, I
for
like using ammonium lactate. They do have it over the counter as well. And sometimes our patients will get a prescription strength. It's, a lot of patients who are on dialysis and they have really dry skin and it's itchy and peeling. It works wonders for them. But there are other ones in the market too, but just that came to mind. We use a lot of it.
what ingredients don't you in a
I
moisturizing
I
cream?
don't know. Sometimes some people say lanolin and all may cause reactions. Just like any kind of perfume stuff, it's not good for our patients.
Yeah, no, that's
Some
really
people like
important.
Eucerin, they like Aquaphor, they like, the ammonium lactate creams.
And I would imagine for diabetics, we hear a lot of diabetics not only have some neuropathy in their feet, but also in their hands. Do you take care of your hands like you do your feet?
Yeah, I guess the feet, we're not looking as much. We could, see something quicker with our hands, but
Right.
certainly, especially if they're, sticking the fingers all the time with, checking their blood glucose. If they're doing it the old-fashioned way, it could get, your fingers can get sore, and you don't want to neglect those and your fingernails. I see some patients getting, some sores on the tips of the fingers just from other comorbidities they may have.
Unlike your toes, your fingers, you can put a little moisturizer in between your fingers, right?
Right. Yeah, that's right. Especially those winter months when our hands are so dry from constantly washing them. Good hand washing. We're washing our hands more throughout the day and then our feet, so they're going to get dry and um, prone to cracking.
And what about, I mean, in terms of dealing with pressure wounds, calluses, things like that for people with diabetic feet? Is there, first off, to prevent pressure wounds, what would you suggest for a diabetic patient when it comes to foot care?
Yeah, and I would just say not to walk around barefoot. It sounds like a simple thing, but really you don't want anything that you're going to step on, that you may not notice and get stuck to your foot. Or if you're walking on the beach or something and the sand is hot, you can get a burn from that. So just always wear good fitting footwear, because if you're not, you may be putting pressure on one particular area, which could lead to a callus. And then over time, if you don't have the feeling in your feet and you have neuropathy, the way you're putting your pressure may alter how you're walking and then could lead to structural changes in the foot. So to wear good fitting shoes, no open toes, they say. I know it's the summertime, and just not to walk barefoot. Good socks too. You don't want a sock with a seam that's going to be rubbing and causing a problem.
Oh, that's fantastic. Did we cover? I think we went through that whole diabetic foot care just like this.
And good cotton socks so your feet could breathe too, because you don't want anything that's going to be trapping moisture.
And how often, I mean, should you be checking your feet every single day?
Really should be
Every
checking them every day, washing their feet daily, and if there's any
Oh,
problems,
really? So washing their feet daily too.
washing the feet daily and a good assessment and getting in between those toes, moisturizing, and even checking before you put the footwear on. You want to actually shake the shoe out, because we've seen people put their foot in the shoe and then maybe a pebble or some kind of debris got in there, and now they're walking around and they have no idea until they remove their socks and see blood on the sock. They say, "Hey, what's that?" And then they realize there was, a nail in the foot, or a pebble. So if they weren't monitoring the feet every day, they wouldn't even notice that, until it's major complications.
Yeah, we just had a patient with type 2 diabetes that ended up in neuropathy. And there are two types of neuropathy, right? You have the numbness, and you have the pain. That's two different types. So he had the numbness. So he ended up out in the yard fixing a fence and stepped on 3 nails
Wow. Oh my God.
and did not even know it until he got into the house and his wife went to check another wound that he had. And she was couldn't believe what she was seeing. Three
Wow.
nails into his foot that he had no idea were even there. That's a great trip to the hospital, unexpected,
Unbelievable. Yes.
right? So you really do need to be very, very careful. So I want to open it up to anyone who has any questions on foot wounds, but of course, Ann Walsh has a lot of experience with all kinds of different wounds in wound care. She has the app again, Wound Care Pro, designed for physicians and clinicians to get the latest information on wound care. So we can open it up for questions, first starting with any foot care, but also I see Charles has a question. He actually wants to shift from foot to shoulder.
Oh, there you
And
go.
yeah, so he shared a few pictures here, um, of what he's got going on following. What type of surgery did you have, Charles?
It was a rotator cuff surgery, and they also reattached my bicep.
Oh, wow.
That's the wound that I shared. That is the bicep reattachment. They did it like in your armpit, and I got like a hematoma that started expressing itself, and it stopped bleeding now. But I just wanted to know, how do I take care of that since it's in a like a fold?
Yeah, it's a tough spot. I'm glad at least it drained that hematoma. Are you washing it with the soap and water or saline or wound cleanser just to keep that
Yeah,
clean,
we
or
were
in the
doing
shower?
saline while we was changing bandages, but it stopped now. So I've just been using like Dial,
Okay, that's good.
not like scrubbing it, but just cleaning it gently.
Gently. Are you putting a piece of gauze or something there? Because it seems open and you don't want that rubbing under the arm.
Yeah, we're still putting gauze on it,
Okay.
even though it's not bleeding actively anymore.
Okay. Because it still looks like it's opened a little bit. Are you putting any kind of ointment?
No, they said no ointment.
Okay. All right. So we can keep an eye on it. If the gauze tends to stick, then we could always talk to whoever, the surgeon was. But it
Okay.
looks good from here so far. I know you have all that bruising.
Yeah, it's still like very aggravated because
Yeah.
of the surgery and the hematoma.
Yeah. Yeah.
But they
Imagine
said the
it's healing
hematoma would take
because
a while.
Yeah, it'll take a while.
under the armpit, you were mentioning earlier, that's really difficult. That's such a difficult spot because, I mean, one, he's probably not supposed to be moving his arm too much. And they
Right.
usually tell you to keep it right close to the side. But if you have, something sealed underneath your arm, I mean, that would breed and just scream infection, right?
Yeah, well, hopefully the gauze will let some air get in there and dry up any kind of moisture between that area sweating and also any drainage from the wound.
Yeah. She
And
answered your
also cut down
question,
the
Charles?
friction. So if you're moving, you don't want that, rubbing.
Yeah,
Right.
no.
Right. It's still in the immobilizer sling for most of the day. They tell me to take it off for a little while to get some rest, but still kind of stay in the same position or just straight out. But when I do get a rest, I do try to move it a little bit to the left to try to get some air in there.
Yeah.
It's good. And hopefully your nutrition is good to try to help the healing.
Yes, I'm a kidney transplant patient, So I always
Okay.
deal with protein problems, but I've been doing 2 protein shakes a day just to add to my diet
Okay.
for healing. I'm not diabetic though.
Okay.
which is good. At least
Yeah,
we
Yeah,
don't have the symptoms, right?
right.
absolutely.
But it's so
But
difficult, and I would imagine, I mean, when you do have chronic kidney disease patient, when it comes to wound healing, because they do say you need to up the protein, but with CKD patients, you need to balance the protein and you need to watch the protein and make sure you're not getting too much.
right.
Absolutely. And then the anemia, if you have that, you got to make sure that's corrected. So there's a lot, but I'm sure you have close relationship with the registered dietitian. So
Yes,
that's
yes.
good.
And I do have severe anemia.
Oh, okay. Yeah.
But you said something about I also am a amputee. I had 2 toes taken off of my right leg from PAD.
Yeah.
And you talked about I can't remember the name of what you said, the moisturizer you said.
Yeah. I just mentioned one we've used called ammonium lactate, or the brand name might be lachydrin. We just have to use it a lot. A lot of our patients with kidney problems get such dry skin, itchy skin. It's
Yeah.
over the counter, but sometimes we prescribe it too for a stronger strength, 12%.
Okay.
So maybe your provider could send you if you need it.
Okay, I'm writing it down now.
I could put it in the chat if you want, if to spell it out if you want.
Yes, please.
Sure.
That would be great. Really good information. I mean,
Yeah, we love that stuff.
we just don't know sometimes, when we go into the doctor, we don't know what to ask. And
Yeah, I definitely, because I've tried like everything over the counter and nothing seems to like work over 15 minutes.
Yeah, we've had patients with a severe callus, dry skin. It's coming off, and this is the only thing we find that helps. We'll say 1 to 2 times a day as needed for the dry skin.
Okay, thank you.
You're welcome.
And thank you, Charles. And I wanted to see if Diana wanted to jump in with a question or give us an update as to where she's at. I know that she had spoken up a couple of times in earlier sessions that we have had when we first started doing these with you, nurse practitioner Ann. So, Diana, how are you doing?
I'm okay. So I just had a toe amputated maybe a month ago now. It's my second toe. I am diabetic and a PAD patient as well. Um, I think some of the things that I do struggle with is just kind of even for me to, have that daily, or not even daily, like washing my feet, right? In the past, when I had my first amputation, when I just tried, they always said to keep it dry, and even to shower, it's a struggle, because when the water gets into the wound, then I end up getting an infection. So the very first amputation I got, it was just infection after infection. Like as soon as, one went away, I got a new one. This time is a little bit better. Um, I think also with experience, just kind of knowing how to wash like between the toes and everything without having to step into the shower. Um, and then just the wound care as well. But I guess, a question I have would be, you know, some of the dressings that the nurses have given me, this is like with different doctors. I think there's like a curate, um, there's like a petroleum base, and then there was another one. I don't remember
Oh, it's a
what.
zero form. It's yellow and it has this strong smell to it.
Yeah, yeah. So that, and then there's another one. Um, so a month ago when I had the amputation, the reason why I had the amputation was because the tip of my toe had turned gangrenous. Okay. And you know, like how do we dress that or clean it, right? There's, even the betadine, and then the zero form, and then that other one, that last one. Um, and I don't remember what it's called. Like how do you decide what's the right um solution?
Yeah, I mean, when there's gangrene, I wouldn't use a zero form because it's adding moisture. I would do the betadine by itself because it's a drying agent, and we're trying to, keep that area dry and cut down any bacteria that may overgrow. If we add moisture to it, like the zero form, in that case, it's adding moisture and it could soften it and turn from dry gangrene, so it's sort of intact, to wet gangrene. So, but if it's an open, clean wound, the zero form is good if there's not much drainage. So it all depends. What is this wound looking like? Is it clean? Is it necrotic? What are we dealing with? And how much drainage is there? So, but if you were using betadine and gangrene, then I wouldn't use zero form with that because they're kind of
Okay.
competing against each other.
Okay. And then what about dressings?
So
What are
it
Mhm.
depends. I try it definitely with the diabetic foot. I wouldn't use any, or somebody with PAD, tape on the skin. That drives me crazy. If I see somebody with arterial ulcer and somebody's taping the gauze on the skin, I'm like, oh my God, that's going to cause more problems. So what I would do is clean it, whether it's wound cleanser, whatever you're cleaning it with. And again, if it's a clean wound, there's lots of options: hydrogel, honey products, silver products on the wound, then put gauze and do a gauze wrap to secure it without putting tape on the skin. Or if it's between the toes, sometimes I'll tuck the gauze between the toe, and
Mhm.
like when you go get your nails done and you don't have to use any tape, it stays on. So it all depends, like, how much drainage. Again, if it was heavier drainage and clean, then I would use calcium alginates and hydrofibers, lots of options. So it's all
Okay.
according to, and we change. Now it's not draining so much. We don't need that dressing. We'll switch to this one, which is going to hydrate the wound.
Okay. And then when do you, of all the things that you just listed, when would you recommend the honey?
So if it's a clean wound, mainly clean, little maybe yellow tissue is okay, and not draining much, the honey is great because it's going to clean that up. It's going to hydrate it. It's going to cut down chance of infection,
Mhm.
and it works for up to 7 days. So you could even not necessarily do it every day if you didn't want to.
Okay.
Are we
Thank
talking
you.
medicinal honey, or are we talking, New Zealand Manuka honey off the shelf at the local drugstore?
Yeah, it's Manuka honey, but sterilized. So that a couple of companies have it. You can get it off Amazon, or if you have home care, they can order it for you.
So it is medicinal honey, but it's Manuka honey.
Yeah,
But
Manuka
make
honey.
sure you're not just getting the random jar that you would consume orally. It's
Right, exactly.
sterilized
Yeah, you get it from the
before.
couple of companies have their own brands, and yeah. But one guy used to tell us when he was talking about his brand, he said, "You could put it on your bagel. It's real honey." But yeah. So, but you wouldn't go the other way around to get honey off the store and put it on your wound. But
See, that's
Thank
really good
you.
to know, and that's what right,
yeah,
Diana. I mean, that's
Yeah.
even when you go to Amazon, you need to look for. It should say medicinal honey, right?
yeah,
It should.
it'll say Manuka honey. But yeah, if it was gangrene, I wouldn't put the honey on that. So consult folks. The only thing I would put on gangrene is betadine, unless you had allergy to it. And then if it's an open wound, and then you don't want betadine in those wounds, then you want the honeys and these different products.
Okay. Thank you.
You're welcome.
Thank you, Diana. And Douglas. Douglas has questions about shoes and socks and such. Douglas, go ahead and unmute. You just got a new pair of socks that you've been talking about, didn't you?
I bought some smart wool socks, and I can tell a difference. I absolutely can tell a difference in how my toes feel in that. But during the summer, I sweat a lot, and I do have sometimes I have issues getting rid of the toenail in between my pinky and the
Yeah.
next toe. It stays chafed or something, and we're told not. I really have never been able to find something to get rid of that on a regular basis.
Yeah, sometimes between the toes, if I get anyone with our patients, we send like some powder over, if we feel like there's fungus, nystatin powder, rather than putting a cream in there. So the powder will cut down the friction, absorb any moisture, and treat any fungal infection that may be there. Especially if your sugar's on the high end, again, you're more prone to fungal infections. And a lot of times we'll do it twice a day just to clear that up, and I'm seeing good results.
Is there a certain type?
Well, nystatin is one of them, prescription item, or miconazole powder. If there's a fungal infection. I don't know if you have a podiatrist you work with, or
Not at this time. So
okay.
I don't know if I could get What about like over the counter?
Oh, yeah, I was just saying over the counter, maybe like cornstarch or something that's going to keep it dry in between the toes may be helpful, especially the summer months, and if there's any rubbing going on,
Cool.
And I say the best for last. Toenails.
Oh, yeah.
That always becomes the issue, especially with diabetics and for people with circulation issues caused by or known as peripheral artery disease. We hear this over and over and over again. They end up going, especially women, they end up going to get a pedicure, and suddenly they end up with a wound that won't heal and amputation. So we don't want that.
No.
What is the best rule of thumb, especially for, I would say, not only diabetics, but a lot of diabetics have peripheral artery disease as well. What is your rule of thumb for toenail?
Yeah, I mean, if somebody's able to cut it themselves, if they don't have severe disease and have good vision and good dexterity, cutting the nails straight across or filing them. Otherwise, really got to get to a podiatrist, not to mess around if you're not, we've seen that where somebody will say, oh, my son cut my toenails, and then next thing is a wound that mom has or whatever, because, it's just too risky, and people, dexterity, vision issues, and whatever. And if you have neuropathy in your hands, you may not be able to. So podiatry visit's important. At least once a year, medical, evaluation of your feet. If you have a problem, you should be going more frequently, maybe every 6 months or 3 months or 1 month, depending on what's going on with the person. If you have a wound or you have calluses to be tended to and thickened toenails that you need to get treated, you really need to be seen by a podiatrist.
And so Diana just jumped in. She wants to know about amlactin. It has 12% lactic. Is that the same? I'm not sure what she's asking.
Yeah, that one is
What
a
is
prescription
that?
strength. I think you can get over the counter. Amlactin. Let me look at it. Might be just another brand name. I'll look it up right now. But that's probably the prescription strength. Let's see. Yeah, that's it. Ammonium lactate. That's just another brand. But the same thing. Yeah, that may be a prescription item, but they do have a lesser strength over the counter.
Okay. This I think is over the counter.
Oh, good. All right. So good.
Okay.
So she's getting what she needs.
That's perfect.
And I have a general question. I think so overall I have neuropathy as well, and it's very difficult for me to wear any type of shoes, like majority of the time. And sometimes the only thing I can wear is something like sandals. Shoes, maybe I can wear maybe once every other month before it starts flaring up again. So, just in terms of those types of issues, do you have any recommendations?
I think, podiatrists are, invaluable to measure your feet and to sort of see, to get a custom fit. Even for myself, I was having a lot of toe trouble. I don't have diabetes, but I have a, high arch. So I was putting all the pressure on my toes and they would burn. So I went to a podiatrist. She had me stand and, molded something to my feet, sent it off. Now I insert that in any shoe I wear or sneaker. And it took a while, but it made a difference. So I think, getting almost custom fit if you can. I think a lot of insurances will cover them if, the podiatrist, like I said, gets a good measurement of your feet or a mold and sends off for a custom fit insert or custom shoes if you can. Because you don't want that squeeze into those narrow heels. You want, nice to sort of open box, the front of the toe, plenty of room there. In other words, its toes aren't squished together or rubbing.
Okay, thank you.
You're welcome.
Diana, what about those? What about Crocs? The ones not. Yeah, you make sure you have the heel strap up. A lot of people wear those Crocs, and they're covered, right? But they have a lot of the holes through, and they have a wide toe box.
Right.
Yeah, the problem with Crocs for me is that there's like little bumps on the bottom of the sole. Those tear my skin, and it's very painful once it tears.
Yeah, it's a really tough situation. I do hear this a lot, that some patients with the diabetes, and their podiatrist says, okay, you need to wear shoes, but then they can't really wear shoes, and it can be, even with co-pays, it can be expensive to get the custom fit shoes. They need to design some, maybe on Amazon, I would imagine, there would be something, or a lot of really different products that you might not be able to get locally, that you can do a search on there to see if there's something might be a good fit. And
Yeah, I even see when you go into
know,
CVS, not that I've ever tried it, but they have a machine there. You can literally stand on it and they can see where your pressure points are. So I don't know if that, in your situation, but it's a lot cheaper than the insert that I end up buying for. But
Yeah,
yeah,
I
I ended
have.
up
Go ahead.
what do you have?
So I have had the custom inserts, and then so I had to have the shoes with it. It was like double wide, double depth. And but what ended up happening was my foot also swells up on some days. So when
yeah.
I walked, the crease ended up tearing my skin. And so it's kind of like some days it works, some days it doesn't. And then once I get that one wound, then I get, then I get problems.
You know what's interesting is we just had an issue similar to this from a patient over in Florida. And I don't know if you've ever had your veins checked to see if there's some venous insufficiency in there, but this patient never had her veins checked, and the valves weren't working properly, and the blood ended up backing up clear into the toe, and that was actually causing the wound in the toe to not heal, according to her vascular surgeon. And I had never heard that before, and that was a first for me. And so, talking to you right now and hearing you talk about the swelling, yeah, I wonder if that's something that you've gotten checked before, or in recent months have gotten it checked, and it might be something that you may want to ask your doctor about.
Okay.
Absolutely. If you have even if you have mixed venous and arterial disease, you may be able to have light compression. That'll keep the swelling at bay.
Yep.
Okay.
Thank you, Diana, for
Thank-
jumping in and
Yeah,
asking
thank you.
questions. And of course, we will be back next week. I want to be very conscious of your time, nurse practitioner Anne. Don't want to take up too much. We could talk forever and ever.
Oh,
We have so
yeah,
many
right.
different topics we can address. Any ideas before we close of next week and what you want to address, or maybe, from our gallery here, our live studio audience, anyone have any ideas of what you want her to go over in depth maybe next week? Anne, any ideas?
Yeah, I think we're talking about maybe some wound cleansing at home and how to maybe manage, something like that, perhaps. That might be one
Yeah.
topic.
I'd be interested in that. I was gonna ask if we could go through like wound care products, just like the ones you mentioned today, like
Oh,
pros
sure.
and cons of each type or of product.
Okay, sure. Maybe I could even put a snapshot together just of what they look like, something like that, just so we could
Yeah.
visualize what I'm talking about.
Yeah,
Okay,
that'd be great.
sure.
Thank you.
You're welcome.
We love that. And thank you, Diana, as well. So next week, make sure you tune in. Same bad time, same bad channel, right here at youtube.com/The Weight of My Heart. We'll be putting up a promo. So all you have to do is click on live, then click on that promo for nurse practitioner Anne Walsh and our Wound Care Pro series. And just click on notify, and you'll get notified when we are actually live. And I think it actually notifies you as well earlier that day, or it gives you an hour, heads up that it's coming up, so you don't miss it. And if you want to join our live studio audience, you can always email me at kym@padhelp.org, kym@padhelp.org, and we can invite you into our live studio audience separately. But of course, we have our amazing YouTube producer, Josh, who's there every single show, and he is gathering your comments and your questions right there from the comment section of the video. So if you're a little camera shy, you just want to stick in comments, that's fine too. We will not miss your comments or your questions. Okay, just want to make sure you go to the App Store, either on the iPhone or on Android, Google Play, and you can download Wound Care Pro. It's $4.99. It's for physicians and clinicians to get a better idea on the cutting edge tools and techniques available for treating wounds. Nurse practitioner Anne Walsh, thank you so much for joining us.
You're welcome. Great to see everybody.
Every week. And we'll see everyone again next week.